Hello, I'm Duncan Muhumira, and welcome back to Children and Not Small Adults. Today we have a bit of a different presentation, a different outlook, and that is okay, bringing some variation. And following our last episode, which was episode 6 on quick facts on COVID-19 and home-based care, today we return with a long awaited special session on COVID-19, what we know so far. And basically today we have a talk with an expert in the field. So you're welcome to our special session. Today we are privileged to have with us on the channel our very own, the sensational Dr. Catherine Costers. Dr. Catherine is a specialist in internal medicine, infectious diseases. She has also specialized in microbiology, virology, and infections epidemiology. She's been at the forefront of fighting this COVID-19 pandemic. She's the head of an isolation center, an isolation COVID unit here in Germany in a high-level general hospital, Helios Hospital in Krefeld. And for many of us, we know that Dr. Catherine has also been with us through this pandemic in Uganda. She has been with us setting up the COVID unit in Lubaga, the isolation unit, developing and implementing SOPs and basically really moving with us. She's been with us physically there, and she's been with us also online and advising and handling it with us. So we are very, very privileged to welcome Dr. Catherine. Dr. Catherine, you're welcome to Children and Not Small Adults. How do you do?
Hello, thank you very much for this nice introduction. I'm fine, thanks very much. How are you?
Very good, very good. We are looking really forward to jump into our topic today, COVID-19 and what we know so far. To begin with, we would like to reflect a bit how Germany has been, I remember that in November, December last year, Germany had also a peak in one of the waves of COVID-19 where the situation was difficult to manage, where the hospitals were full, the ICUs were full, where the workers were burned out, you know, and where things like PPE and so we were striving, Germany was also striving with these things. What are the ways that Germany managed to handle the crisis of COVID-19?
Well, it all depends a bit on which area you really mean. You mean for the whole country, or do you mean for our hospital? Well, in our hospital, I think it was very important that we all work together, all nurses, doctors, workers in other fields of the hospital, physiotherapists, everybody. So it was not the work of, you know, just one or two specialists, not at all. It was work coming from all of us. Okay. And I think that's probably, one of the most important aspects in the hospital, that we could handle the situation, especially with, and you're right, especially with nurses being burnt out, and really, especially nurses on ITU, they had a lot to do, and it was not very nice what they always saw. So they did have a very hard time, and they only managed with good colleagues who worked together with that, who understood them. So working together is probably one of the main things for a hospital to manage.
That's very interesting. The teamwork, the bringing in all the areas, everybody is as important, and hearing everybody out and giving them a chance to then input in the work and in the care of patients.
Yeah,
that's very good. Talking about, again, the treatment, sort of which treatment options have been found to be successful in the management of COVID-19 disease in Germany, in your experience?
Well, it started off in the beginning when really nobody knew what to do and what to give. Yeah. So if you focus on medication at that time, I think people tried a lot of different things without being sure that it worked and without good studies.
Yeah.
So because it is a viral disease, I think the most important is a good nursing care.
Mm-hmm. Yeah.
But then in the second, third wave, there were some studies that came out and that showed that, for example, steroids are very important.
Okay.
They shouldn't be given very early in the disease, but after 7-8 days, steroids really made a difference, and it was shown that they lowered mortality of the disease.
Okay.
Other possible treatments are antivirals.
Mm-hmm.
They're still not so convincing. That's the remdesivir.
Yeah.
There are probably some patients who will profit from the remdesivir, but it's not something you'd give to every patient. You really have to select the patients who would profit from that drug.
Okay.
And then for the last couple of months, we've had monoclonal antibodies.
Yeah.
And again, they do seem to work, but also only in very special situations. Those patients have to be very early in the disease. So there are some drugs, steroids probably being the ones with the most effect so far.
Mm-hmm.
And there are some other drugs which I haven't gone into now. But again, the general care on the ward, the nurses looking after the patients, the doctors looking after the patients, making sure is the patient, does he need more oxygen, less oxygen? Yeah. Does he need to lie on his stomach, turn around? Does he need fluids? I think that is very important.
Okay. Okay, very good. That really sheds some light on the situation, and that also brings us to the interesting topic about antibiotics. We spoke a little bit about them here on children and not small adults in our last video. Currently, the misuse of antibiotics is generally a big problem. In Uganda, for example, we had already sort of a problem with antibiotic use, but now in COVID-19 time, it has become much, much worse. Not only are medical professionals basically encouraging the use of antibiotics to treat patients with COVID-19, but the people also self-medicate. They just go and buy it from the pharmacy. In which situations would you recommend the use of antibiotics in COVID-19?
Well, we don't usually prescribe antibiotics for patients with mild COVID-19 who are not admitted to hospital.
Okay.
So they don't generally get antibiotics. For patients with moderate to severe COVID-19 who are admitted to the hospital, we only give them if we do think that the patient also has a bacterial superinfection. For example, in a patient who has a typical infiltrate on a chest X-ray or on a CT, if you see signs infiltrate of a lobar pneumonia, or in patients with a very high procalcitonin, which points towards a bacterial infection.
Yeah.
Studies say that only very few patients have a bacterial superinfection, around 2%. And then there's those patients who deteriorate very quickly and have to be admitted to ICU. Then we often start antibiotics, but stop them again after 3 to 4 days if we don't find a bacterial infection.
Okay.
And by the way, COVID patients in ICU may get super infected by a fungus called aspergillus, and in that case, antibiotics don't help anyway.
Yeah, exactly.
So we do try to really restrict the use of antibiotics in this viral disease.
Okay, very, very, very helpful. It really brings out that medical workers, especially health workers, need to be careful and need to not just give the antibiotics, but also knowing the background that antibiotics are not going to make a difference if you have the viral infection, COVID-19, rather when you are convinced or when you have run some tests to tell you that there's a bacterial infection. That really puts things into light. It makes things sound even a bit simple. If you don't have the signs for bacterial infection, if you don't have the tests to confirm it, don't use antibiotics. Yeah, great. What about COVID-19 in children? This is also another sort of special topic. We know that mortality rate is lower, with the numbers of hospitalization also being low among children, and that some complications in children still occur, even though generally the numbers of COVID-19 complicated cases in children are low. We have seen or heard about the multisystemic inflammatory syndrome that tends to occur. What more information would you add on, or would you highlight as important among children with COVID-19?
Okay, first of all, I have to admit, COVID in children is not my field as such, but we've just had a patient with this pediatric inflammatory multisystem syndrome, and well, yes, it's a frightening syndrome occurring within weeks or within days and weeks after a COVID infection. Okay. Children can present with high fever, they can have abdominal pain, vomiting, skin manifestations, some have renal or cardiac failure. Yeah. They look as if they were severely septic, and many have to go to ITU, but luckily the outcome is mostly good.
Okay.
So that's the inflammatory syndrome. And it also looks that you can have post-COVID in children. Most information and studies on post-COVID are in adults, but early research shows that it can also affect children and teenagers, and that it can occur after mild COVID disease.
Okay.
The definition is still not universal. So it's at the moment it's still difficult to say who has this post-COVID syndrome. The National Institute for Health and Care Excellence in the UK, they define post-COVID as signs and symptoms that develop during or after an infection with SARS-CoV-2 and continues for more than 12 weeks after the acute infection and is not explained by other diseases. Many symptoms or main symptoms are breathlessness, fatigue, body aches. People often say they have brain fog or loss of taste, loss of smell.
Okay. Now we're going into another interesting topic, the Corona D variant mutation. Oh. Yes, this has been also described. This has been, it is common in Uganda at the moment among the people who are being tested. Common in, as you know, all over countries in Africa, in South America. It is rampaging in the UK. What can you say about it in general, this Corona D variant mutation?
Okay, Corona D variant. Well, there's still a lot to be learned on the Delta variant. Yeah, for sure. And there are definitely many details about the Delta that I don't know yet. All I can tell you is Delta seems to be at least as dangerous as all the other variants and maybe even more dangerous. Data from the UK show that the risk for hospitalization among unvaccinated people is higher if they're infected with the Delta than with the Alpha variant. Okay. It also seems to be more important to have both vaccine shots, because only then you have a good protection against the Delta variant. And it does not matter if you had the AstraZeneca vaccine or one of the mRNA vaccines. It also seems to be more transmissible. Okay. And yeah, well, that's about it.
That is a lot of information. I must say that is already gives us a good assessment, a good way to think about the differences and how the mutation is changing. In our last video here on Children and Not Small Adults, episode 6, we also talked about a little bit of a definition of the mutation and how it can change, how it presents, and that already brings into perspective a real presentation that we are seeing, a real difference that we are seeing with the mutation, with the COVID-19 changing. Great, very great. And now lastly, we've got with our last question here, when you hear about the situation going on in Uganda at the moment, the pictures that we're seeing, you know, the health workers fighting this disease, and we're losing some of them to it. You know, families torn apart, the country back in lockdown. It's a really, you know, tough time. Does that remind you of a similar time when things were very bad in Germany? And what message would you give to our colleagues back in Uganda in this difficult time?
Okay, well, good question. Well, we didn't have, it wasn't quite that bad as it is in Uganda now, but at the beginning, right at the beginning, we didn't have enough PPE. And I know we had meetings where we thought about how we're going to reuse the PPEs, what can we reuse, or what can we use as masks. And so we used masks from scuba diving for caring for patients.
Wow.
So we did improvise a lot. And I remember one day where we didn't know if we had enough hand disinfection for the next day. So we had to buy big containers from a local factory here in Krefeld. So there was not enough of everything, and that's something we weren't used to here in Germany, actually. So usually you get everything. That was a big change.
Yeah.
So we definitely learned to improvise at that time.
Okay.
The other thing is, stay together, work together. Everybody has to do her part. Everybody in the country has to wear masks, keep the distance, help each other. I think that's so important. If somebody's in quarantine, you go shopping for him or her. So that's different. And last, not least, I mean, I know you've got very good doctors at Lubaga Hospital. You've got very experienced nurses there. And if they work together, and I know they do, you are making the best of it. And that's all you can do.
Great. That's very encouraging, really. Thank you very much. Thank you very much for joining us, Dr. Kathleen. We truly, truly appreciate the time to greet us and say hello, and for us to see you and talk to you again about this topic. I would say that is it. Would you like to have a last message or so?
No, thanks very much. It was a pleasure being with you here. If you have any more questions, well, yes, always don't hesitate to contact me.
Great.
And I really wish you and your country good luck.
Thank you very much. We truly, truly appreciate that. And thank you very much for being with us on Children and Not Small Adults. As usual, for questions and topic suggestions, additions, and any information you'd like to share with us, simply write us on this email below. And remember to subscribe also. And thank you very much to all those who have already subscribed and showing your support and moving with us. Next week, we will bring another episode in this bracket still, and sort of just looking a bit deeper at COVID-19 in children. What are the studies saying? And just specifically narrowing down in children. Other than that, we'll see you next week.